Well, as fentanyl overdose deaths rise nationwide, law enforcement agencies face challenges tracking and identifying the drug. A new bill, co-sponsored by Northern Virginia Congresswoman Abigail Spanberger, aims to change that. Mauricio Casillas explains what's in the bill and investigates the larger challenges our communities face with this deadly drug.
A roundtable discussion in Prince William County to talk about the powerful grip of addiction and a drug that's responsible for most overdose deaths. Fentanyl.
The words that come to mind to me are sinister, ruthless, and vicious.
In Virginia, 75% of overdose deaths come from fentanyl, and it's the #1 cause of unnatural deaths in the Commonwealth.
It is clear that both parties agree on the need to give law enforcement the tools that they need to fight fentanyl in our communities, and we need to just get it done.
Congresswoman Abigail Spanberger co-introduced the Providing Officers with Electronic Resources, or POWER Act, last month. A bill that would provide funding for local law enforcement to buy handheld drug screening devices, allowing officers to know if a substance is laced with fentanyl immediately. Chief NEWSHAM calls it a game changer.
We don't find out for months, what the nature of the drug that was used. Even if there's some residue or some drugs left on the scene, we don't have the ability to test that with certainty.
That's because a lab must test the substance, a process full of backlogs, according to the chief. Police say if officers had screening devices, they would instantly know if they've been exposed to fentanyl, and it would allow departments to alert communities there are drugs that could be lethally laced.
Being able to provide that warning quickly can save lives.
Many of those who spoke at the roundtable say more resources need to be made available for the mental health care professionals who treat addiction.
I grew up in the crack cocaine era. It's similar to what we're experiencing now. And a lot of it comes from mental health disorders.
Spanberger says the next step is continuing to drum up bipartisan support to see if this can pass as a standalone bill or to see if this is included as part of a larger piece of legislation.